Ladies and gentlemen, welcome to the webinar Stock Taking on Safe School Reopening, with a focus on pandemic preparedness and response related to WASH in schools. This webinar is jointly organized by the WASH in Schools Network and the Asia Pacific Technical Working Group, the TWG on health, school health, nutrition and well-being. The WINS network is a global interagency network of WINS whose aim is to harmonize efforts and support governments working to improve WINS services and to promote exchange of experience between countries. And the Asia Pacific Working Group on School Health, Nutrition and Wellbeing is a subgroup of the Learning and Education 2030 Plus networking group. It aims at strengthening coordination of interagency efforts in Asia and the Pacific on situating school health, nutrition and well-being with the context of regional and national COVID-19 recovery and resilient plans, particularly plans of the education sector. My name is Herwig Langthaler, and I have the pleasure to guide you through the next 2 hours of this webinar. So what can you expect from this webinar? The organizers have prepared a program which focuses on good practices, on lessons learned, on remaining challenges in relation to WASH in schools. And here you already see the agenda slide with the sequence of steps and a sequence of presentation. You see that after welcoming words, we will have a first overview presentation, setting the frame, setting the scene, followed by 4 country cases. For each country case, a presentation, and then the possibility to raise your questions to the speakers via the chat. At the end, again, closing remarks to wrap up and summarize. What you do not see here yet in between some of the presentations, we have prepared also something to involve you, the participants. And as we have such a high number of participants today, we will do this via the Mentimeter tool. This is something you will need your smartphone for. And in order to make you familiar with that, in order to test that, I would like to start with asking you to grab your smartphone now, take your mobile phone, to open the browser. And then please, may I see the slide prepared for that? Yeah, thank you very much, Beata. To take your smartphone, to open the browser and to enter www.menti.com. Or you scan the QR code if you prefer. So everybody, please take your mobile phone, go to www.menti.com. Meanwhile, I can announce, and it was already announced via the chat, that all the recordings and proceedings will be shared with you after the webinar. We will use your emails which you entered in the registration form. And as I said, for interacting with the speakers, as we are so many participants today, we are asking you to do this via the chat function a little bit later then. So back to the Mentimeter. If you enter that site, then you see that code 67908757. Please enter that. Please enter that code. And when you did so, you will find a thumbs up icon. Please press that, and then you see here in the bottom right corner the number of participants already using that Mentimeter tool. So 24 at the moment. We will wait a little bit for more participants to enter. Uh, 29. $30. 32. I'm asking now the team of the organizers to enter the code also in the chat, please, of the MS Teams, so that we can keep it also there. And then I propose to start with the first question. It's just a test question, which you will find very soon on your mobile phone. Beata, may I ask for the first question, please? And here it comes. So, in which country do you work? Just to get an overview about where participants are from. And when typing in that country, automatically such a word cloud will be generated. Very good. So we have Philippines. The bigger the word, the more often it was typed in by participants. So obviously most of you from the Philippines, from India, from Indonesia, also Germany, Sri Lanka, Nepal, Bangladesh, Ethiopia. One of you is working worldwide, Asia Pacific region, South Africa, Vietnam, Pakistan. Very good. Meanwhile, we have 48 participants. If you do not manage to enter now, not a problem. This is just for testing and making you familiar with that tool. We will come back later back to this type of questionnaire. Okay, Kenya, I see. Laos, Sri Lanka. Very good. Okay, thank you very much. Let's move to the next question. To have an overview from which type of organizations everybody from the audience is from. To have a little bit a picture where where participants are mainly from. So I see 3 people from UNICEF. I see some development partners such as GSZ and others, NGOs, private sector, UNESCO, Ministry of Health, still most from development partners, followed by NGOs, and UNICEF, also from local government or district or state government. And a few participants from other types of organizations. Okay, thank you very much. So this provides us with a first picture and insight where participants are from which country, or at least in which country you are working, and from which type of organizations you are. If it did not work with the Mentimeter, no problem at all. This was a first test run. We will come back in about 15 minutes, and then we will use the Mentimeter again. So please keep it open, or in the meantime try again to connect using the same code, which you again find in the chat function of MS Teams. Okay. Thank you very much for this. We can close the Mentimeter for now, and we continue with our welcome note, which is mainly on the purpose of the event. And I have the pleasure to ask Dr. Bella Monse on the virtual stage to turn on the camera. Bella is senior advisor with GSZ, working on the topic of WASH in schools and school health promotion since more than 20 years in Asia. She has been involved in the WINS global networking activities for the last 10 years or so, and she's a core group member of the global WINS network. Bella, I see you are ready. May I ask you for your welcoming remarks, please?
Yes, thank you, Herwig, for this nice introduction. Yes, dear colleagues and dear partners, in behalf of the WINS network, I'm welcoming you to this event. And as Herwig already explained, I would just to say it again, the network is an informal interagency network to foster alignment and harmonization of strategies between different development partners, government, non-government organizations, in order to better support ministries of education and other government agencies to improve water, sanitation, hygiene in schools around the globe. So alignment and fostering harmonization of strategies is of utmost importance to better support the ministries. The network is guided by the SDGs, specifically that all schools by 2030 around the globe have access to basic drinking water, basic sanitation, and basic hygiene services. For this, please visit the website of the network. The link can be found in the chat box to see more about the network. I'm very happy if you join the movement. As we all know, the COVID-19 pandemic has caused huge changes and challenges in nearly everyone's life, and specifically in the life of children. Schools around the globe have been closed, and in some countries, schools have not opened until today. So global bodies like the WHO, UNICEF, UNESCO have developed recommendations to support ministries of education and ministries of health to develop country-specific guidelines for safe operation and for safe reopening and safe operation of schools. And schools around the globe are very much challenged to assess the WINS staff, and washing schools plays a major role in the safe reopening and safe management of schools. So schools around the globe are very much challenged to assess the WINS status of the schools, to improve it in order to adhere to these sometimes quite complex guidelines, and how to improve, and WASH in school plays a major role. The WINS network supports specifically the exchange of experience of ministries of education and other players in the education landscape to foster learning from each other's experience, and to specifically learn and use what others have already learned. So in this spirit, I'm very happy and thankful that we have very experienced and reputed speakers today from UNESCO and from government and non-government agencies from different countries and different continents to share their knowledge and experience and inspire a fruitful discussion and learning. So without further delay, let us open our ears and minds to listen to our distinguished speakers. Thank you very much.
Thank you very much, Bella, for that opening. Thank you very much. We will hear more from you then later at the very end, but also in between. With this, I would like to ask Janelle to open the video. She will provide us with an overview about the COVID-related situation in schools based on latest data. And Janelle is a regional advisor at the Education for Health and Wellbeing section for inclusive quality education at the UNESCO office in Bangkok. Furthermore, she's also co-chair of the technical working group. Janelle, I already see you. I see that you I already see your first slide. So the floor is yours. Please, Janelle.
Thank you, Herwig. Good afternoon, good morning to ladies and gentlemen, colleagues all joining in today's meeting. It's a pleasure to be here wearing the two hats that Herwig so kindly already introduced. So I've been asked to sort of do a short scene setting presentation on what we can say, what we know about the progress and challenges and key considerations in school reopening. Next slide, please. Okay, great. Many of you are no doubt familiar with this UNESCO global tracking map on school closure and reopening. In 2020, schools around the world were fully closed across all 4 education levels for 79 instruction days on average. And that figure ranged from as low as 53 days in higher income countries to as high as 115 days in lower or middle income countries. This is, of course, information that is rapidly evolving, and at any moment in time when we do a snap like this, things would have changed. But certainly by at least the late part of September, around now, there was still an estimated 17 countries globally that still had in place country-wide school closures, and these are the darkest blue portions that you see on this map that sort of leaned over to the Asia Pacific region, with some of Africa. Several of the countries with the longest periods of school closure do indeed come from South and Southeast Asia. Next slide, please. So in this slide and the next one, which is just a summary of data that's being tracked by our colleagues at UNICEF, again showing the same kind of data around a school reopening, full school closures, which is indicated by the red color, partial school reopening, which is indicated by the yellow color, and full school opening, indicated by the green color. And you can see from as early as the first real thrust of COVID-19 infection in March last year, where just about all schools shut their doors, and they did so for over many months, at least up until June or July in some cases, and then very slowly, incrementally moving to partial reopening around September. In this year, of course, with resurgences, with the Delta variant, no doubt, we've seen some reclosures once more, and of course that there's disparity that exists between and within countries as well. That's important to recall. Next slide, please. Again, going further east to East Asia and the Pacific, the same kind of data on school reopening, closure, fully open, and academic break. In this case, our neighbors in East Asia and Pacific fared a little bit better, but you can see with a lot of the green color between, well, this is data actually just from this year, so we don't have the contrasting data displayed from last year, where a lot of countries were able to do well in terms of school reopening, but still we do see disruptions and resurgences in terms of partial closures and school and full closures as well. So those resurgences of course are important to factor in as part of the planning, and what they mean, those resurgences, in terms of not only disruption in education, but disruption in everything, all the other services that schools do provide. Next slide, please. So in this slide then, just to highlight some key messages, we know that even in communities with the highest rates of COVID-19 infection, the World Health Organization recommends that schools do stay open in all but the most extreme cases. And we have some data that really supports that decision. Analysis of data from school reopening at the end of 2020 suggests that with mitigation measures in place, community infection rates should not be affected by children returning to school. Children and schools are unlikely to be the main drivers of COVID-19 transmission. When COVID transmission is low, with appropriate public health measures in place and a plan for outbreak prevention and the management, schools can reopen, classes can resume. Although children carry a lower risk of infection, they do have large numbers of contact in the school environment. So of course, hygiene and social distancing measures and all the types of preventative measures need to be in place, and they are important in that setting, and which is why the efficacy of WASH interventions becomes so important, to be able to put those mitigation measures in place. School closures where there is no general lockdown increases risk to children. Many countries have prioritized the opening of other types of settings, factories, restaurants, bars, salons, gyms, while keeping schools closed. And this really leaves parents to make very difficult choices, and really serves to be a violation of children's right to education when the public health data says that schools can reopen safely. We're all aware of the negative impacts of extended school closures on learners' education, health, and broader well-being, and that these negative impacts are especially felt by those learners who are particularly vulnerable. Next slide, please. Bella mentioned about some of the resources that have been available, still are available, and being produced all the time to help inform country decisions around school reopening. So yes, many tools exist, but the truth is we don't have as much data as we would like around the implementation and the extent to which they can be implemented. Back to school strategies need to ensure the readiness of education systems for school reopening and learning continuity and system resilience to anticipate, reduce the risk, and deal with possible resurgences. And we're really looking forward to, in today's session, to be able to hear more from the countries and from all of you in the call around an assessment, readiness assessment, and the extent to which you've been able to implement practical guidance. Next slide, please. Okay, so minimizing disease transmission in schools requires measures that schools can implement with their existing infrastructure and limited additional investment, such as increases in hand hygiene or air ventilation, as well as measures that may require even more investment or coordination between the education sector and other sectors, for instance, health sector or transport sector, as well as public commitment. So these on screen are some findings taken from the UNESCO, UNICEF, World Bank and OECD Global Survey on National Education Sector Responses to COVID-19 School Closures. If that's not a report that you're familiar with, I recommend you do have a look. The survey findings are presented in 3 iterations. And what's on screen is the findings from the 3rd iteration that was published in July of this year. This survey documents how countries are monitoring and mitigating learning losses, addressing the challenges of school reopening and deploying distance learning strategies. In total, 142 countries responded to this survey, and the 3rd iteration covers data collection between February to May of this year, spanning pre-primary, primary, lower secondary and upper secondary levels. So in this first slide, looking at the kinds of education sector responses and the extent to which they were able to put in place different measures around school health and hygiene guidelines. Globally, 98 of 99 countries confirmed that their ministries of education have endorsed specific health and hygiene guidelines and measures for schools. Countries have responded to the pandemic nearly universally by promoting practices that mitigate transmission in schools, particularly those related to physical distancing and hand and respiratory hygiene, which is what you see in this figure here. The reported rate of the use of all measures was higher in this 3rd iteration of the survey and in the current wave of the epidemic compared with previous rounds of surveys, the last of which was completed during July and October of last year. So even that increase between last survey and this survey on the implementation of these measures is quite promising. The greatest increases were found in the use of self-isolation and tracking of staff and students who were either exposed to or otherwise infected by COVID-19. However, those activities that did require additional investment or coordination with other sectors, such as contact tracing or testing in schools or waste management or transport safety, still did exhibit lower rates of adoption in terms of practice. For example, 57% of low-income countries, country respondents in the sample reported that their country tracks students or staff exposed to or infected by COVID-19 compared to the global average doing that measure at a level of 73%. And most interestingly and concerningly, I think for us today in the session, although the promotion of hand hygiene was nearly universal across countries, only 1 of 11 low-income countries, so less than 10%, reported that there were sufficient resources such as soap, clean water, wash facilities and masks to ensure the safety of all learners and staff, in contrast to 96% of respondents from high-income countries. So I want you to hold on to that figure. Less than 10% of countries, low-income countries, have measures in place to implement wash facilities. Next slide, please. Yes, we can go. Oh, that's fine. So while 55% of countries globally indicate that health and safety guidelines were being implemented in all schools, only 1 in 4 respondents from low-income countries reported universal implementation of those guidelines. Next slide, please.
Time, please.
Thank you, Herrig. When asked to identify bottlenecks that impede the implementation of safety measures, lack of commitment or a culture of safety among the public dominates the responses. The lack of resources and medical facilities in the community is also a central concern for lower income countries. These are the countries that really must heavily rely on external donors to fund purchases of resources required for school opening. I'm just going to proceed quickly through now the next couple of slides in the interest of time. Next, we can go forward. And you will have access to these slides after the presentation to look into some of this kind of data that I would encourage you to be conscious of, data on the extent of teacher vaccinations and the role that plays in the decisions around school opening. Please go ahead. Next. I won't pause here because today this is where we want to focus our discussions, the challenges and actual responses of WASH in school programming to document experiences from you. Next. And one last slide to the very final slide after this one. Brilliant. So really, ladies and gentlemen, oops. Just one back, thank you. So where we'd like to leave these messages, in as much as we're focusing today on a deep dive on WASH in schools and its relationship with school reopening, we really are encouraging positioning these within a broader messages, a broader context of integrated school health programming. Many of you are perhaps aware of recently launched guidelines on health promoting schools, standards and frameworks, as well as case studies available to you. And actually, in the next month, on 12th to 14th of October, there will be an interministerial regional meeting on health promoting schools to really help advance this agenda, not only for longer term efforts on safe school reopening and learning recovery, but also in terms of COVID-19 related school reopening as well. So longer term, but immediate measures of sustainable and well invested health promoting schools efforts. So sorry to have rushed through the last couple of slides. Again, these are available to you and we're happy to take any interactions in the chat during the rest of today's meeting. Thank you.
Okay, thank you very much, Janelle. This was great. I know 10 minutes is not so much, and you had so much information, and you, with this, set very well the scene for the upcoming 4 country cases, which we'll be hearing very soon. Before that, I would like to ask all the participants again to take your mobile phone. We have prepared another 4 questions with the Mentimeter. And this time we would like, after Janelle's overview, we would like to reflect a little bit on the situation in the countries where you, the audience, is from. Please again open the mobile phone, and I see that participants are already typing in the answer. Yes, very good. The first question is whether in the country where you work, the schools, so primary and secondary schools, are at the moment open, all opened, partly opened, or still closed at the moment. And again, we see the number of people participating with this survey in the bottom right corner. And at this stage, I would like to bring in Bella again to ask her just for a brief comment or reflection on what you see at this slide and also at the other slides. Does this surprise you, what you see here, Bella, when you see that pie or not?
No, not so, because I think majority of our participants come from Asia, as we could see in the beginning, so that fits very much to what Janelle just discussed and said, that majority of school partly opened and closed schools are in some African countries, but majority is in Southeast Asia. So I think that is very well reflected when we see this here in this pie chart, so that nearly half of schools partly open, so that only a very short percentage of schools are fully opened, and that would apply for countries in Europe and the US and other countries. Yeah.
Okay. Thank you very much, Bella. Please stay with the video on. Let's go to the next question, please. So, are schools able to comply with the EPC PPR measures? Well, according to your observations and your knowledge, yeah, on a scale from 1 to 5. And also, of course, taking into consideration that there are big differences within each country, but just to have an overall idea in how far they are able to comply with, whereas 5 would be very easy for the schools to comply with. And what we see here now is an average of 2.4 at the moment, and participants are still entering their answers.
Yeah, and perhaps also, even if schools are still closed in the country you work, if you see the schools in your mind, would they be able to comply with the specific pandemic preparedness response or infection prevention and control measures? So that would be, even they're closed, but if they would be open, would they be able to comply?
Yeah.
Yeah.
So between 1 and 5, it's 2.5. What can we deduct from that, Bella?
Yeah, we can say that schools seem to feel it rather difficult and not easy. So they do not really feel, or that our assessment is that schools are not really prepared to really comply with the measures. And that is also very much in line with what Janelle had told us before, really saying that less than 10% of countries in low-income countries are only able to comply with these measures. So then we are feeling even far better than the real picture most probably is, that we think they can comply with, or at least go into the direction to go with. But as Janelle pointed out, only 10% are able, compared to 96% of schools in high-income countries.
Yeah.
And that reflects with the audience we have, where they come from.
Yeah.
Okay.
So it's a little bit below average. Let us move to the next question, please. And this is about, again, in the country where you work, what do you regard as most difficult for schools to comply with? So from that list you see those options, please choose a maximum of 3. What do you regard as most difficult for the schools to comply with? And please also do not forget to press the submit or send button, because only then it will be sent to the Mentimeter and we can see it here on the screen. So social distance measures obviously seem to be most difficult for schools to comply with, followed by supplies, or also water availability. But still, it's the social distance measures. Yeah, Bella, what can you say here about that picture?
Yeah, just I think this is very much in line with surveys from countries which already half a year ago, where countries in Europe and the US were open and surveys were done, and they were saying the hygiene parts, even they have washing facilities and everything. They say that's something schools can comply with, but they cannot comply with the social distancing. So that is something which is physical distancing, which is very difficult for schools to do. It's nearly impossible. And of course, we can see this is followed by hygiene measures, specifically availability of supplies, which has a lot to do that the resources are not sufficient to really take care of supplies. So I think that's very much in line. So we can with this webinar, I think we will look a bit into the area of WASH-related challenges. So this is all on that left side here, and I think the social distancing is something which is a bit outside the WASH in schools concept, but of course we align ourselves in supporting governments within all the measures, so we also take care of the other measures. Okay, yeah.
Okay, thank you very much, Bella. We have one more question for you, for the participants. And this is again in the country where you work. So at country level, what is in place already to support schools to safely reopen and operate? So what kind of measures, policies, and so on is already in place? Please choose here as many as appropriate. And then we can also have a picture about what is already there. This seems to be at the moment a rather balanced picture. Implementing protocols or guidelines, national policies, minimum health standards seem to be mostly already in place. Yeah, again, for a last time for now, I hand over to you, Bella, for your sharing of your reflections.
Yeah, I think this pretty much pictures the experience of all people in this call, that very often the policies are in place and this is being done, but there's big difficulties to implement them. If we could see the difference between, for example, policies implementing guidelines and then on the other hand, distribution of hygiene kits at scale. So even policies are in place, schools do not have the resources to have hygiene kits, have soap, have hand washing soap or cleaning material at hand. So that is something at least we can see always the difficulty. I'm impressed, I have to say, I'm impressed that there are many monitoring systems for IPC already in place, which at least seems to be 1/3 of answers is going also into this. So that's great to see that this is in place. I didn't expect such a high system already, or such high figure for monitoring systems in place, but we all know only what monitors gets done. So very important to put monitoring systems in place, and we'll hear more about this. And yeah, I think that leads to our speakers. Thanks.
Exactly. Thank you very much, Bella, for now, and we will hear more from you at the end of this webinar. With this picture here, we are closing for now the reflection on the countries where the participants are working in. It was an interesting impression, and we continue with the country cases now. The first country case comes from Indonesia, presented by Dr. Haris Iskandar. He was a former Director General, Early Childhood Education and Community Education at the Ministry of Education and Culture in Indonesia. And today, Dr. Haris is a Senior Trainer at the Ministry of Education, Culture, Research and Technology, as well as Head of the Education Section for Behavioral Change at the National Task Force for COVID-19 in Indonesia. Dr. Haris, I already see you. We are looking very much forward to hearing from Indonesia. Please, the floor is yours, and you will be sharing the slides yourself, I think.
Yes, thank you, Harry. Thank you, Bella, for inviting us for here, sharing Indonesian experience in safe reopening of schools, which is, as speak today, we are in all over Indonesia is now opening a school. Can you see my presentation?
Not yet.
Not yet. Okay, let me try. Okay, here you go. This is different from Zoom, yeah? No?
We do not see it yet, no. But if it does not work at all, then we will ask our team of organizers to share it. Maybe to try it one more time.
Can you see it?
No, not yet, no.
Oh. Oh. It was tried out successfully.
Yes, we tried before and it worked perfectly.
Yes, it was before. So
yeah, but
perfectly.
This is not a problem. Dr. Harris, if it's okay for you, then we ask the team to share it,
ahead,
and you then ask for the next slide.
Okay.
When you want.
Okay. So turn it off.
Okay, here it is.
Okay, safe reopening of school in Indonesian case here, and now it's a very good time because this is a 535 days, right? Almost 2 years we've been in the pandemic, and I think Indonesia is now next in the very good and declining stage with the positivity rate below 5%, and we are hoping that for the next 28 or even more longer, we'll be heading toward handling the situation, successfully. And the response for this pandemic, we had that since last year, educational disruption and our responses, policy responses by school closures, and also school exams, national exams also canceled, and the new student admission also fully online. So a lot of things, at least 26 or 30 national policies adjusted according to the situation. And in terms of the face-to-face learning mode, since July, the four ministers, Minister of Education, Minister of Religious Affairs, and Ministers Health, and also Ministry of Home Affairs, signed a joint decree on which a school that is allowed to open face-to-face instruction. So as we know, that National Task Force doing risk assessment regularly every week, and using a 4-zone. Indonesia divided by 4 zones. The green is safe, and green, yellow, orange, and red is severe. Later is then translate into level 1, level 2, level 3, level 4. That's according to the community transmission and also the health response, right? So only a school that's located at green zone and that could open. Later, 2 months later, revised decree that's also school at yellow also allowed. Yeah. But then in the end of the year, which is then the January, in January 2021, all authorities to reopen approval for reopening school delegated fully to local governments. Yeah, because what happened is if we go down into the micro level, even in orange zone, yeah, you can see a lot of villages also in green at the green zone, yeah, meaning that very low risk, and the school that's situated in that green village was supposed to have some learning activities with safe. Yeah? So that's why the decision whether you open or not is delegated fully to local governments. So since January until now, so actually next. And what happened with the rest is remaining using distant learning or learning at home. Yeah? And we are serving about 68 million students, yeah, total, yeah. As we know that Indonesian education system, there's a general one, which is under the Ministry of Education. There's also a religious school, yeah, they supervise under the Ministry of Religion Affairs, yeah. And other ministry also have some schools, mostly with specialty, yeah. And our support to all the schools. First is the relaxation on school grant program. Yeah. So we have what we call it school grant program for operational that is fully covered by central government. And we give them relaxation so the school can purchase goods and services for health and hygiene goods facilities. And the second one is also we have teacher training sharing through online. We have internal quote subsidies for every family to have access to internet. Although not all Indonesians covered by the internet networks. It's around 83 or 85%. And we have also the curriculum, emergency curriculum during pandemic is a special curriculum. National assessment and alternative, and sanitation and health campaign is continued. Those all things, I think that is the support to student learning at home. Next. And the progress of teachers vaccination program, up to now, we're reaching up to 62% for those one. We're supposed to complete it on June, but then no, it's not happening in June, but now it's still kind of progressing. The first priority in Indonesia is the doctor, nurse, and all health personnel, and teacher is the second one. It's still also the priority. Next. We are hoping at the end of this month, we'll be finishing all 100%. And in terms of the school readiness assessment checklist to reopen, in our joint minister, it's really explained that if every school or education units they want to reopen, they have to fulfill all conditions. One is the availability of sanitation and hygiene facilities. Which is toilets, hand washing facilities with soap and disinfectants. And reported it is the real time self-reported website we designed. You can visit that one. So it's almost all actually ready, 96%. And 96% for what hand washing facilities. This is very much wash kind of campaign facility. It's already in place in our school. The second one is the availability of health facilities, access to health facilities and required area for masks and have thermal guns. And our national campaign also on mask wearing, on hand washing and keeping distance also should be in place in the school. They have to report that. And the third one is on monitoring or tracking. It's the proper term probably tracking teachers, administration, and students that advise not to attend school. Those have comorbid, those that have access or contact, close contact with the positives. Those have traveled from high-risk cities or whatever, and also no access to transportation. So that is lower compared to other criteria. This is self-reported. Probably you can visit, but I think have no time. Next, because Harry is already up here. And based on the risk assessment, 95% of schools are located in level 1, level 2, level 3. So they actually, by risk assessment, they are allowed to open school in every island. Next, next. So, but the reality, those open schools now, as we speak, is only 40%. Next, this is national. So this is from August. This is the development from last year until now. The yellow one is the learning by distance, and yellow one, sorry, the green one is learning by distance. The yellow one is limited the face-to-face. It's only 40%. We are expected 95%, but the reality is 40%. Next. And the bottleneck is, I said, this is the local government who has authority now, whether to open or to close. That is a challenge right now. So practical experience, the readiness indicator for reopening school in Indonesia, the one that all 4 items that I mentioned, or we can extend it into what, six items. One is the availability of hygiene, yeah, and the second one is the access to the health services, and also and then mapping or checking the member of our education units personnel and the teachers and also students, yeah, and also approval from parents, approval from school committee. That is the whole criteria that before they are opening the school. So I think that's practice that now best practice that we are doing now in Indonesia. The last probably the recommendation one is we can say that to how to accelerate vaccination program for teachers, administrators, and students. Yeah, above 12 years old. We already done around 10% right now. We hope this accelerated, giving a lot of confidence for local government to giving approval to school want to open face-to-face. The second one is local education and health office to verify and validate. They have to visit. They have visit to those school who submit for reopening. And also local transportation office to ensure the availability of public safe transportation mode. And also the fourth one is the local, we have a local COVID task force in every district, yeah, to keep campaigning and educating the health protocols, wearing masks, washing hands, keeping distance, restriction for public and private gatherings, and limiting domestic movement. And the last recommendation, is most important one, is to have an active role of local governments to ensure the success of limited face-to-face learning activity. I think that's all my 10 minutes, Harry. Thank you very much.
Okay, thank you very much, Dr. Harris. Thank you very much for this interesting case from Indonesia. I do not see yet any questions in the chat, so we would have a few minutes left for one or two questions. So let's wait a little bit if a question comes in. At least I do not see anything here yet, but I will at this point now check with Lucy Leclerc. Lucy, maybe you can also turn on your video for a short moment. She's an experienced WINS expert and working as a consultant for the WINS Network Secretariat. Here she is. She has been also involved in the preparation of this event, and she will now support a little bit in forwarding questions from the chat to the speakers, now to Dr. Harris. So what can you see so far?
Thank you very much, Herwig, and thank you, Dr. Harris, for your presentation. I hope the participant can also refer to the link that was placed in the chat box also to see the detail of the dashboard. In terms of question, I see actually one in the chat box for now, which is also linked to an overall question that we are interested to hear from the speakers. So we would be very curious, Dr. Herwig, Dr. Harris, to know to which extent has such a extensive school readiness assessment actually triggered or inspired action at school level? And this is very much linked to the first question that we have on the chat box to know what has been done to make sure that actually those wash facilities became functional. So this is really much more school level intervention. Maybe you could elaborate on this. I see another question or so, which is, let's start with those two ones and then we'll take the next one. Thank you.
Okay, thank you very much. The first one, as I mentioned, the support for our, I think the policy support for this one is they have flexibility or relaxation in terms of school grant program. They can buy anything, purchase anything that is urgently needed, including health and hygiene goods and services. That's, I think, the first one that I think giving school a lot of leeway to purchase and to provide learning health facilities in school. The second one, we also have a school task force for COVID. So every school was asked to have their own task force to do socializing on the protocol, health protocol, yeah, on wearing mask, keeping distance, also washing hand, yeah. And also giving parents in terms of kind of instruction on how to have a safe come back to school, yeah, by giving them some kind of advice. They have to have nutrition and give a breakfast and have to have their own learning materials, sport material, music, everything by their own. So and also going to school with safe public or private transportation. That kind of tips and strategies is delivered by school to parents, reaching our parents. Yeah, this is as we speak. That's what's happening right now. All the preparation is now done together with school and parents and community.
Okay, thank you. Lucy, back to you. Maybe one more and a short, a short answer to one more question. Then we would have to continue.
Great. So now we were at school level. Now I'd like to move more at the level of the institutional arrangement. There is a good question on, and that's also varies very much between different countries. There are some countries, many countries in which Ministry of Education is not really devolved. But now in this COVID-19 time, there are more and more responsibilities being given to those local governments. So what is the experience of Indonesia in this? What institutional arrangement did you put in place to empower those local governments to implement those different actions towards safe school reopening? Thank you very much.
Yes, thank you. This is, we are delegating to local government on reopening a school by the end of last year. But then even come back to us, it's become bottleneck now. Now we want them to approve, but then they have probably a lot of things in their plate. So they're not really doing all verification and validation to each school. So that's why in terms of the approving rate is very slow. So this has become a bottleneck for us. In our eyes, from our risk assessment of COVID risk assessment, 95% of schools are supposed to open today, But as we witness now, it's only 40% they open. Because of what? Because the local government is not approved yet. Why? It's probably it's too much things to do. That's my I don't know what's happening, but it's not really happening. This is self-reported in our website. It's self-reported by school, and we have giving a quick survey. What is the reason for not reopening? And they said the local governments, parents already been giving approval, but the majority of schools said it's because of local government has not processed our proposal. So they haven't visited us, they haven't given approval. So it's become a bottleneck. See, it's kind of a difficult situation right now here in Indonesia.
Okay, thank you very much, Dr. Harris. There are more questions, of course, to you. Unfortunately, we have to continue. I would like to ask you, if possible, to have a look at those questions in the chat, and sure, if possible, to place also some answers during the next presentations in the next hour, if possible. Thank you very much again. Also, thank you, Lucy. And with this, we continue with a next country case from another continent, from Africa, in particular from South Africa. I'm asking to turn on the video, Mrs. Mary Metcalf. Here she is. Very good. Thank you very much. She has worked as a teacher. She has worked as a principal, served as provincial minister for education in Gauteng, as head of school of education at the University of the Witwatersrand, and as Director General of the Department of Higher Education. And today she's CEO of PILO, an NPO for improving learning outcomes at scale. And she's also Senior Research Associate at the University of Johannesburg. Mary, may I ask for your presentation? We are looking very much forward to hear from South Africa now.
Thank you very much. am very happy and learning a lot from the presentations that have been made. My presentation is a little bit different to, for example, the last one from Harris, which looks at what government is doing to monitor, because this one looks at what the teacher unions have done with surveys to look at school readiness to open. I'll explain what was done and why. So just very quickly, there's several key factors affecting school closure and opening. One is the national state of regulations in terms of lockdown. And the second is a very important one. It's both school readiness as well as confidence in the public about school opening. So clearly school readiness is a factor in opening. Now, in terms of the extent of school closures, the first presentation by, well, the first presentation was fantastic in looking at the extent across internationally. In South Africa, it's difficult to say precisely how much school were closed, but in 2020, 54% of school time was lost, but there was great variation by grade. We prioritized the last year of secondary schooling, the last year of primary schooling, but some grades lost as much as 6 months of schooling. Now, the urgency of keeping schools open has also been well articulated. In South Africa, there are huge challenges, particularly for the poor, of learning at home. So keeping school closed and learning at home is not a viable option. But there's also, as was explained in the first presentation, huge benefits in terms of socio-emotional support and school feeding. And then another way of articulating what was said earlier is that, well, I took a position, the unions took a position, that schools can actually function as a barrier to transmission if they're properly resourced and if they're properly managed. So the union surveys were done basically as a model for collaboration and triangulation with what government was suggesting was in the place. Our systems are not as sophisticated as in Harris's presentation, so there's a lot of compliance reporting. So the unions did the surveys and were able to do comparative analysis, disaggregated geographically, and looking at progress over time as a basis of discussion. Now, the unions, it was a very powerful reach to all of our schools because we used WhatsApp and we used a technology platform which was a very quick survey. There was no verification, so there were limitations. But we reached in the first survey 40% of all schools in the country, so it was a sample. And that's because the unions represent 95% of teachers in the country. We got the principals to submit. Now, one of the analyses that we developed that I think is quite important in terms of understanding what we mean by readiness is there's a difference between material readiness, institutional readiness, and teaching readiness. The institution has to have the systems in place based on having the correct material, the correct PPEs. And actually one can't assume that because there's material and institutional readiness, that teaching readiness automatically follows. There's particular work that needs to be done as educators to be ready. So the material readiness is as you would expect. These were the questions that we asked schools when they were preparing to be ready for the different grades when they were returning, and we also looked at it in terms of this is what it was 2 weeks ago, the progress has been made, schools are now ready. So those are what you would expect, it's what you've heard, aligned with standard operating procedures, aligned with World Health Organizations. There's two that I've put in italics at the bottom, because readiness also requires community readiness, discussion with school governing bodies, and you need a supportive bureaucracy that's talking to principals and giving them guidance. So we included as the line manager, the circuit manager in touch, and are you talking to your school governing body, which is a vital link to community. In terms of the institutional readiness, you'll see that this is very subjective. We're saying, do you have enough confidence that you have the materials now? So it's a sequential next step, but do you have the systems? Because there's huge institutional management shifts in managing what has to happen in schools. So are you confident that you can clean classrooms twice a day, that you have systems to wash hands when children enter classrooms? Have you got systems for drying hands with paper? And again, in terms of institutional readiness, is the principal communicating with parents? Because parents also need to be ready. And then with teaching readiness, because of the time lost, the curriculum guidance needed to change. And then we asked principals, have your subject teams or your phase, like foundation phase, early grade, met to review the guidance? Are you planning for work at home? Now, just to quickly look at South Africa and to look at the important principle that's come out in earlier presentations of poverty and readiness. So South Africa has 9 provinces, and I'm focusing on only 3 provinces, Limpopo, KwaZulu-Natal and Eastern Cape. And why I'm focusing on them is that in this poverty map, where blue represents low poverty and red represents high poverty, you can see that there's large sections of the country which are much more blue and others which are much more red. I'm looking at Limpopo, which has 16% of our schools, KwaZulu-Natal, which is 24% of our schools, and Eastern Cape, I can't see because my screen is covering that, but it's about 16%, I think. Now, those 3 provinces have the majority of schools in the country, and they are also the poorest. So the disaggregation in our analysis between provinces becomes important. Provinces are the main drivers of the education delivery. That's where teachers are paid, that's where material is bought. So let me just give you an example of the kind of data that we were able to produce, the kind of data that was shared with government at national level primarily, but also at provincial level, and which the teacher unions were able to use in their public communication with their members and also with the media. So the analysis that I'm going to give you is by color coding, as everybody does these days. I made these to be readiness below 50%, readiness between 50 and 80, and readiness above 80. Arguably, those could be different, but it was a useful tool of analysis. So this is the one page of the survey results for material readiness, and it was on the 5th of June last year when we were, are we ready for grades 7 and 12? What is important is that you can see some key material challenges nationally. And I want to look at water. So water, only 2 provinces, the wealthier provinces of Gauteng and Western Cape, had adequate water. The rest of the 7 provinces only had between 52% and 75% readiness in terms of water. That is a huge challenge. In all provinces where there is not water at school, we also looked at where the water tanks delivered. We'll come back to that. The second thing is to look at the provincial variations. You can see KwaZulu-Natal was below in 80 on 7 measures. Eastern Cape was below 80 on 10 measures, and Limpopo was below on 5 measures. So those 3 provinces representing 62% of the schools. were the least well served. So as a country, the challenges are to do material inequalities, the differing capabilities to support schools. A very important thing, I think, which is underestimated is the protective measures, because the science changes and we overestimated physical over airborne transmission. Cost of PPE took away our infrastructure budget. Learning loss was the greatest with the poor. With the unions, the challenges was survey fatigue. And I think that the challenge is always maintaining something that I'm passionate about, which is government-union collaboration. Thank you for letting me finish on this slide, because I think my time is up. The key learnings are two. Continuity of education is critical, that point's been made. But the other thing that I think we underestimate, school leaders can solve problems we haven't even imagined. Thank you very much.
Great. Thank you very much, Mary. Thank you very much also for this perspective of those two types of readiness. Very interesting. And I think the first question goes already in that direction. Lucy, may I ask you now to come in again? And Mary, please keep on the video. Yes, please, Lucy.
Thank you, Irving, and thank you, Mary, for this excellent presentation. Maybe one specific question and then one more general one. So the first one is from those two different types of readiness, which one would you, from the experience, which one was more challenging and which was seemed to be more easy for schools to put in place? And then opening up to this is how have these results been used at the different levels, so national, provincial, and school level?
Thank you for that first question. I really love it, because my closing comment was we have to trust our school leaders to solve problems that we hadn't imagined. So the most challenging is actually giving people the resources for them to then use their understanding and agency and understanding of context to adapt. And there was huge ingenuity in that adaptation. So I would say without the material resources and without the knowledge, then if they have the knowledge and they have the resources, the adaptation of managing a school, principals know what to do. But I don't want to underestimate the importance of the being prepared for teaching. And of course, that will be country specific with its challenges. In terms of how the material was used, I would say that generally as a advice and for discussion with other countries, the importance of union collaboration is critical, because the more stakeholders you have, speaking with a common voice and giving confidence to the public, confidence to the teachers, the better. But of course, under times of huge administrative pressure, relationships are strained and there are disputes. So I don't think that this data was used as collaboratively as I would have liked, but it was definitely used to challenge false claims about readiness. And that is because government was dependent on reporting up, and that was often compliance reporting.
Great, thank you very much. Lucy, one more question or?
Yes, maybe one more question. Could you maybe elaborate a little bit more on the confidence indicators?
Yes, so confidence was because we were saying to principals, the learners are about to come back. You've got the material or you haven't got the material. Are you ready now to use that material? So if you say, do you have the systems in place? They weren't tested. It was saying, are you ready to use those systems when the learners come back? And what I found was that when we only had 2 grades back, grade 7 and grade 12, the level of confidence was higher. The level of confidence when all the grades returned was much lower, because it is a huge administrative challenge and a management challenge to be vigilant every school hour, 5 days a week, when there are so many learners that you have to reorientate to different patterns of behavior in a school. I don't think we should underestimate the challenges for school management and leadership of leading both teachers and learners into a whole new set of practices.
Okay, great. Thank you very much, Mary. This was a really very interesting insight into the situation in South Africa. Very, very great presentation. We need to continue. If there are still questions in the chat, may I ask you to have a look at that and try to answer in the chat itself. Well, we go back to Asia now, and in particular to India, and to hear about the situation there. We will have now a splitted presentation by two persons. The first one by Dr. Malini Reddy. May I ask you to turn on the video, please? A professor at the Administrative Staff College of India. She's a multidisciplinary researcher and practitioner in the area of urban governance and service delivery. She leads initiatives on WASH, social entrepreneurship, and gender integration. Here she is. Very good. And then directly after her, without any break, will speak Mr. Nella Japan, Assistant Director of the Directorate of School Education at Nagaland and Nodal Officer for Online Education. In his work, he actively contributes towards ensuring the provision of adequate WASH facilities in the schools of Nagaland. I already see the presentation on the screen. Dr. Malini, may I ask you to start, please?
Thank you very much, Harry. A warm welcome to all the participants, and thank you very much for the opportunity to share a few thoughts and experiences from India. Next slide, please, Liz. Yeah. So I belong to an organization called Administrative Staff College of India, and we have been working in the area of WASH in schools for several years and lead several initiatives in partnership with organizations such as UNICEF, WASH United, and many other development organizations, and work with the Ministry of Education quite closely in supporting in different programs. You can see the services we offer, and we welcome you to visit our website and join our journey in WASH in schools. Next slide, please. So quickly, to give you a context, I don't have to say this, but India is a large country. We have about 36 states and union territories. The total number of schools is 1.5 million, which is quite a daunting number to handle. And the interesting point that I want to make here is that if you see the breakup of rural and urban schools, you would see that almost 80% of the schools are situated in the rural areas, and 20% or so are situated in the urban areas. If you see the COVID incidence in India, urban India is deeply impacted as compared to rural India. So the incidence of COVID in general has been less in rural India than in urban India. However, the school closures are same. So all the schools in the country were closed. If you see the acceptance of online education is extremely low. It's not to say that there is no access to internet in rural areas. India is very ahead in that. However, having a sufficient number of phones and ability to access online education is very low in rural areas compared to urban areas. And even in urban areas, the acceptance is through different surveys for online education is only about 23% or so. And the same survey showed that the acceptance was as low as 8% in the rural areas. A recent survey just this month, which was done amongst parents of coming from from underprivileged backgrounds, 97% of the rural parents surveyed want the schools to be opened because they feel their children have really suffered. And the survey was done across 15 states. So the reason for sharing this is that I'm just trying to show that the impact of COVID has been tremendously, heart-wrenchingly more for in the rural areas and for the underprivileged. And India, I'm sure other countries are facing this, but India feels that impact, and it's important that we start on this note. So quickly to run through the numbers again, 1.5 million schools, 265 million students, and 9.7 million teachers. So this is what our country is, and I'll quickly take you through some of the measures which have been taken. Next. This was a situation of wash in schools just before the COVID situation. We were doing fairly well between 2012 to 13 and now, which is 2019-20, just before the start of COVID. India was making huge strides in improving its wash facilities. You can see the light pink showing 2012-13 and the dark purple showing. So there's an increasing trend. India was doing very well. As COVID set in, many of the government schools particularly started doubling up. I mean, because the schools were closed, they were used as COVID care centers. So at this point of time, there has been a setback in terms of infrastructure, and schools have been closed, and they need to, again, the national survey, which is a comprehensive countrywide survey, is yet to take place, and we would know. We are a little concerned about it, but we don't know the numbers right now for sure. Next, please. Response to COVID timeline, if you see, next, please. You can just press till the whole thing comes up. Yeah. So our cases really started in Jan 2020. We went into a lockdown in March, and immediately COVID responses related initiatives have been started in the country by the national government. As early as September 2022, standard operating practices were launched by the ministry, and these are taken by all the states and followed. All the states, there was a question on decentralization, so all the states are free to revise and revamp the SOPs as per their requirement. A national portal called Diksha has been set up where extensive training has been conducted. A lot of material has been put up for teacher training as well as material for download by states and schools. So there's considerable amount of extensive capacity building initiatives which have taken up. Next slide, please. This is the current situation. What you see here on the map of India, the orange ones are where we don't have data right now. The blue ones, light blue ones, are the ones where schools are partially open, and the dark blue ones are where the schools are not yet open. So you see a mixed bag, and even where schools are open, it's usually for grades 9 to 12. The younger students are yet to start going to school. These are screenshots of the SOPs which are issued by the national government. Next, please. Initiatives for improving wash in schools have also been taken. A lot of this material is available on the Diksha portal online. Certificate programs are introduced for training. Next, please. These are also materials available. Next, please. For all multiple stakeholders, how to approach this. Now, I just want to take you through this structure which is followed. You see, at the topmost, we have the ministry which is issuing the guidelines, and then we have different states who can take the guidelines and revise them, revamp them to suit their requirements. And then we have district education. Further down, it goes to a level called mandal, and further down to cluster. So at a cluster level, in charge, the official has just about 15 to 25 schools under his or her supervision, and therefore monitoring of wash in schools is pretty close, and what is the situation on ground is pretty known. And this is what we meant by it's completely decentralized, and this is a beautiful system which functions very well in India. Next slide, please. There are three approaches which are taken right now in the country. One is using the structure that I just showed. So there is a district level monitoring, which is what Mr. Niliyappan will speak to you about. He comes from the state of Nagaland, one of the states in the country. So there is a complete system of reporting. The second is a mobile app and dashboard is used for collecting information, and schools update the information themselves. And third is Google Forms are used, as you see on the right side, the picture, for upload of information by the schools on a daily real-time basis. So these three systems are existing and they coexist and they are used. Some states are using one over the other. Next slides, I will request Mr. Niliyappan to please start his presentation. This is a small state and over to you, Mr. Niliyappan. Mr. Niliyappan. Okay, so this is a state with yeah, go ahead. Thank you.
But you're still muted.
Yes.
Okay.
So here is a picture of the facilities, wash facilities available in different schools. Just quickly we can go through it. Majority of our schools falls under the average facilities. Of course, the government schools lag still little behind, but most of the schools falls under the average rating in wash facilities. Next, please. So this is just a glance regarding the wash facilities. Next, please. See, we have nearly 3,000 schools, and most of the schools are in rural area. Nagaland is a hilly state in the Himalayan region. So, and the distribution of schools also in governments, we have nearly 2,000 schools under government organizations and nearly 750 schools under private organizations. And we have 4 lakh students enrolled in the schools and 32,000 teachers serving. Next, please. Now, when it comes to the COVID response, you may kindly see the serial number 5 and 6 in the table. 72% of government school teachers are vaccinated, at least with single dose. And in private sector, 85% of teachers are vaccinated. And non-teaching staff in government sector, 71%. And in private sector, 79%. And here, the special emphasis laid by the state government is, the state government has constituted a district task force under the chairmanship of the district collector, who is also called the deputy commissioner. And the district task force under the chairmanship of the deputy commissioner has all the head of departments of all the line departments, for example, power, medical, public health, engineering, including all departments, the district task force functions. And they have the responsibility of managing the affairs of the district independently. So the district task force, next please. The district task force has designed a checklist. Before we allow the schools to function, initially we allowed classes 11 and 12 to open, and now from September 20 onwards, class 5 to 10 also allowed to function. So before opening, the schools has to fill up a checklist and submit to the district task force through the district education officer. So the district task force individually verify all the checklist, make surprise visits, random check they do. At least each school is inspected by one official from the district task force. So after the assessment permission is given. So the district task force has the entire data of all schools under them. So with this effective management, we are able to see that the schools comply the SOPs and the directives given by the department. And in case of any violation, the Department of School Education manages and handle the issues with the concerned schools. So this is how we manage it. Dr. Malini may kindly take over.
No, thank you very much, Mr. Niliyappan. That's it from our side. Essentially, it's a decentralized system, a considerable amount of capacity building for multiple stakeholders. UNICEF is playing a great role supporting the ministry in rolling out this training program. We work alongside them and it's decentralized. So that's it from our side. Thank you. We're open to any questions you may have.
Okay, great. Thank you very much, both of you, for giving us that interesting insight from India. We are a little bit behind schedule, but nevertheless, if there are one or two quick questions, then we will be able to cover that. If not, maybe questions will come up a little bit later. Lucy, do you have already a question?
Yeah, maybe just some general question. First of all, thank you, Dr. Malini and Mr. Niliyappan. A very good presentation and great to hear also the experience from the States. It sounds like a very elaborated monitoring systems, and we'll have maybe a general question on this. So is it also being used to track projects, to track progress at school level? So this is one general question. And another one, especially because you mentioned the point on a surprise monitoring visit on the ground also. So what is being done with the result of this monitoring system, also at different level of the education governance? Yeah. Thank you very much.
Ma'am, we have a school monitoring portal, online portal, where the schools are required to submit daily data. Now, class-wise enrollment, we have the total enrollment data. So they have to feed the daily attendance. So there we monitor from the state as well as from the district officers, we monitor how is the turnover of the attendance. And in schools where the attendance goes below average, then our field officers, the subdivisional officers, they visit the school and ascertain why the enrollment is very low. Is it because of the public are not aware? So where there are attendance going below the average, we take care of it and we find out the reasons behind it and we rectify it. And the surprise visits are paid by the subdivisional education officers, the area education officers, and the junior education officers. Of course, we will not be able to cover up 100%, but randomly, at least per day, we visit 2 schools. Thank you.
Thank you very much.
Maybe having then one more question, if that's possible. I think it also links with the previous discussion we had. I mean, given the scale of India, what lesson can you share in terms of the role of local government?
So I can take this question, Belinda. Thank you for that. See, essentially, the process here is completely decentralized. There are different levels in which this is taken up. The lowest level and closest to the schools are the city level local government, or in rural areas, the panchayats. So that's the closest. And then both rural and city come under a district. So Mr. Niliyappan is speaking from that angle. So we have district level action committee as formed in his state. Otherwise, the district education officer is in charge of what happens in both the rural and urban schools. Within the local government, within the villages, there are cluster level officers who are in charge of 10 to 15 schools. And so therefore, monitoring is quite close, and therefore information flow is quite comfortable. So, so it's quite decentralized.
Okay, thank you very much. Both Mrs. Reddy and Mr. Neliappan for taking the time to speaking to us from India. Again, I also would like to ask you to have a look at the chat. There might be more questions in the coming minutes, and maybe you can then have a look and try to answer them. Thank you very much. We have one more country case from another continent, from South America, from Ecuador. It is due to organizational reasons a recorded presentation by Mr. Conrad van Grenest, who is a WASH specialist with UNICEF Ecuador. And he led the WASH cluster during the COVID-19 sanitary emergency there, working closely with the Ministry of Ecuador and Ministry of Education in Ecuador on WASH in schools. And as this is a recorded presentation, you can lean back. There will be, of course, no possibility to ask questions later on, but I'm asking now to play that presentation, please.
Good morning and greetings from Quito, Ecuador. It's a pleasure for me to present the case of Ecuador in the stock-taking webinar on safe school reopening and school readiness assessment. My name is Koen van Grenest. I'm a WASH specialist at UNICEF Ecuador. So let me tell you a few data on the education sector in Ecuador. Approximately 16,000 schools countrywide, providing education to 4.4 million children through 220,000 teachers. So the process and the tools during the pandemic, it all started with the suspension of education activities in the entire national territory on 15 March 2020. And then one of the first actions taken was conducting a WASH in Schools national assessment, developing afterwards in July a hygiene protocol for progressive use of educational institutions, afterwards the guidelines for progressive return to school, and then in October 2021, an online course for teachers on WASH in schools was deployed. Then in January 2021, the Ministry of Education did a costing exercise to estimate the cost to cover the WASH in schools gap. And then finally, as of the 1st June 2021, there was a progressive return to presential classes in schools following an approval process. So I will take you through this process and these tools to explain a little bit more in detail how this was conducted and what the results were. So the WASH in Schools national assessment was conducted in June-July 2020, and it was a joint initiative between information, infrastructure and risk management directions of the Ministry of Education with technical assistance of UNICEF. So an online questionnaire was sent to all school directors nationwide, and this questionnaire was based on the core questions for monitoring WASH in schools from the joint monitoring program. Also, a video tutorial was shared with all the schools so that they were able to fill out the questionnaire. There was quite a high response rate. 95% of schools responded to the questionnaires within 10 days after launching the questionnaire. So the consequence of this is that the water, sanitation and hygiene service level was now known for each school countrywide. After this, a hygiene protocol for progressive use of the educational institutions was established jointly between the Ministry of Education and the Ministry of Health. So the most important aspects of this protocol were the guidelines on the use of the mask, then hygiene measures such as avoid touching your face with your hands, frequent hand washing with soap, disinfection of frequently used areas, and then social distancing, and obviously instructions on staying at home when presenting symptoms. This protocol can be downloaded from the Ministry of Education website, and UNICEF provided also technical assistance for the development. After this, in October 2020, there was an online course for teachers launched where this protocol was explained, and also more detail was given on the importance of water, sanitation and hygiene in schools. This course is available on the official Ministry of Education training platform and has been developed with support from UNICEF and Plan International. It consists of 5 training modules, and so far 9 sessions have been developed, and more than 40,000 teachers have completed the course. This is quite a large number, but compared with all the teachers in the education system, this should still increase in the coming months. Now, how does the back to school process works in Ecuador? Every school has to elaborate an institutional plan for continuity of education, scholar permanency and progressive use of installations, which is called PICE. This plan, the general objective is to establish agreements and consensus within the educational community to guarantee continuity, educational permanency of all students, and the progressive use of the educational installations. So each school should establish actions to comply with the hygiene protocol, and this plan should be revised by the Ministry of Education and the Ministry of Health locally and approved by both ministries. So far, as of September 23rd, over 4,000 schools have their plan approved and are expected to return to presential education. You can see that more rural schools have their plan approved than the urban schools, which is due to the fact that risks are lower in rural areas than in urban areas. So as of the 1st of June of this year, 2021, finally the return to schools started to scale up, which was also linked to the new government that took power by the end of May, and a political decision to prioritize the return to schools. As I said before, there was a priority for rural schools due to lower risks. And currently, approximately 25% of all schools have now semi-presential education in place. 81% of these schools are public schools, and there exists a monitoring of the COVID-19 cases related to school reopening, which is conducted with support from the Ministry of Health. Also, UNICEF supported 138 small rural schools with the wash kit to enable them to approve their plan and to return to presential education. You can see that as of the 1st of September, an important number of schools approved their plan, which is due to the fact that the scholar year starts the 1st of September. And finally, the Ministry of Education conducted also an exercise on estimating the costs to cover the WASH in schools gap countrywide with the support of the WASH cluster and UNICEF. And this costing was based on unit costs for interventions to scale up service level from no service to limited service to basic service or to advanced service. So based on this exercise, the estimated total investment needed to cover the gap is $163.6 million. And also there is an urgent investment needed for COVID-19 hygiene measures, mainly provision of soap and disinfectant, which is estimated at $20.4 million. And the UNICEF support to small rural schools, 138 schools, as I mentioned before, had a cost of $28 per student. You can see, for example, in the picture, the mobile hand washing facilities that UNICEF and the Ministry of Education installed in these rural schools to enable them to approve their plan for return to presential classes. So to conclude, the limited WASH services in schools resulted in high vulnerability in during the sanitary emergency. The Ministry of Education's leadership and technical assistance from the cooperation were really crucial in the whole process. And there was now clear evidence of the relevance of WASH in schools for the continuity of education. Before the pandemic, the importance of WASH in schools was often neglected within the education sector, but with the pandemic, this importance of this became very clear. Thank you very much.
Okay, so this was the last country case from South America, from Ecuador. Yeah, with this we are almost at the end of today's webinar. We would like to involve all the participants for a last time. And that's why I ask you to again take your mobile phone for a last round of a few Mentimeter questions, this time to somehow wrap up and summarize what you have heard today. And here's already the first question. So are there any good practices or measures that that could be implemented in your country? What you have seen from the presentations, maybe how to address a challenge, how to implement a specific measure. You can type in a little text, something like a maximum of 5 words. What you regard as a good practice for your country. Would be interesting to see a little bit about that. Here's you find first the code for the Mentimeter, greater involvement of teachers union. Okay, interesting. WASH training and practice for teachers, for example. Centralized decision making, engaging parents, students and teachers, empowering local government to make decisions on school reopening. CSO engagement. Authorization to open to local. Yeah. Online WASH courses to teachers and certification. More intensive parents engagement. Orientation of key stakeholders on WINS. Promoting WINS behavior at practices at home. Capitalizing on HPC structure on all school reopening. Confidence idea on implementing measures, yes, also very interesting. Decentralized monitoring of school compliance with SOPs, especially WINS. Yeah, very, very interesting aspects of what you regard as good practice or something that could be applied in your country as well. Bella, may I ask you to come in for a brief comment on this from your perspective?
Yeah, thanks a lot. I think it's good, and even more, still more answers are coming in. So it seems that the models, or that the good practices, or that that the presentations shared by the speakers have also encouraged ideas and concepts. Yeah, I think specifically it showed what are local governments' issues, what are problems of schools, what are systems in place, and how governments are reacting to this and using it. And I think what we can see here is that it seems a lot of learning is taking place. It's just overwhelming, the amount of inspiration, I would say. So this is exactly the spirit we would like to encourage here. And we all learn from this.
Thank you very much, Bella. Yeah, thank you also to you, dear participants. Let us continue with another question. So again, in the country where you work, in your perspective, what is the biggest remaining challenge that the education sector is facing? Of course, with respect to safe reopening and safe operation of schools. And here we ask you to select just one of the options here, and to see what results we will have here. Okay, first answers coming in. Commitment and coordination. Commitment. The biggest remaining challenges. There might be more challenges, of course, but in the preparation, those 5 have been selected. Mainly commitment still. Bella, what do you think about that?
Yeah,
that picture here?
I mean, it's just a snapshot of that moment about this group. It is not representative at all, but I think looking that the commitment seems to have the highest numbers of being mentioned as the challenge, shows also that commitment to really reopen schools and do it properly seems really to be the one of the main challenge, and that also resonates very much that what Janelle said at the beginning. Schools are still closed, while we still in many countries where other businesses, malls, even bars and restaurants are open, and that is exactly hitting in that direction. That commitment for education and reopening is not high enough.
Okay, thank you, Bella. And as all the other materials, you will find those results of those Mentimeter questionnaires in the documentation of today's webinar. And the last 2 questions brings us back to the webinar itself and also to future events. And here we would kindly ask you to your opinion. So on which topics you would like to get more information in future exchange events such as this, and feel free to choose as many as appropriate. This will help the organizers also and other organizers for future events to estimate a little bit in what direction to go when it comes to the provision of new webinars or other events. And Bella, here again, I also ask you whether the results here are in line of what you have expected or rather not. It seems to be very balanced, by the way. National policies.
I think it's very, very balanced. It seems that the participants here are very interested in all these aspects, basically nearly very balanced, and they're very interested in understanding more about national policies and respective guidelines, but also very much in M&E systems. All of that was tackled by this webinar, but it seems there is even more interest. And I think as a network, we would absolutely be interested to and will react on this to see how we can further work on this exchange and really see these are the information the participants here are interested in, and I think that is very, very well balanced. Very happy to see that. Yes.
Okay, that's good. And this leads us then to our last question, and this is, if you did not find what you would like to see in future, then you have the chance now to enter your ideas on future other topics for such exchange events, for such webinars. Please feel free just to enter as much as you want, what you would like to exchange on in future, if you did not find that in the slide before. We do not have to comment on this now, Bella, I think, because this is just a collection of additional ideas of participants. We are almost at the end of today's webinar, and so that's why I hand over to you, Bella, for a last time. I'm asking you to turn on the video for your closing remarks, and after that, today's webinar is then over. Bella, please.
Yes. Yeah, thanks a lot, Herwig, for guiding us through this event, and thank you everyone who was in here. Thank you specifically to the speakers who brought this and the different steps countries did, which we saw from Ecuador, going over detailed systems being presented and with very interesting inputs from the different countries. I think what came up interestingly is really that even systems are in place, like in Indonesia, and we can see 95% of schools ready, only 40% are really ready and willing to open. A lot of challenges are being surfaced, as well as seeing very interesting assessment tools, I think, to highlight the introduction of the confidence of schools and really looking at school level, how confident are schools, how can we improve this. Then to India, seeing of this massive monitoring, really massive, seeing the amount of schools and seeing that they will daily submit data to monitor. So I think there's a huge range and there's a lot to learn for all of us. And I think just to assure, and also thanks again to Janelle bringing in the perspective, the global perspective from UNESCO through the lens of what happens globally to the reopening of schools and letting us putting a light and shedding a light on challenges and also gains. I think what is important and what the network is very willing to further support is the exchange of experiences within countries. So we continuing to do this, and we will come up with, even as we see there's quite interest, come up with giving other countries the chance to present, and we're very interested to stay in touch with all of you. Please go to the website, engage, and become an active member, so that what you see here in the picture behind me, open and empty classroom, will not be the future. We want to see children again in schools around the globe, visiting schools and being able to be together and participate in learning and support governments to master this tremendous challenge. So with this, I thank Herwig for excellent moderation of the session.
You're welcome. Bella, please turn on your video for the last sentences.
Sorry, I thought in my view my video is on. So
okay, then we need to go out of the Mentimeter.
Okay, because I had the video on. So just this is again, if you see that, the empty classroom, and we want to end this. So I thank Herwig for excellent moderation of the session. Thank everyone for joining. Thank Lucy and specifically all speakers for the commitment and openness to share their experience in a very open and honest way. So thanks a lot, and let us keep the spirit of exchange with each other and moving forward and joining forces. Thanks a lot.